Thank you for joining me today. In this video, we are going to go over a lab monitoring in a psychiatric practice. Laboratory monitoring in psychiatric practice. Laboratory monitoring in psychiatric practice is a highly topic for psychiatric medication because psychiatric medication can affect the metabolism, can affect the hematological, can affect the endocrine, renal, liver, cardiac function. Appropriate baseline and follow-up testing helps prevent adverse effects. Delicate complications early and support safety evidence prescribing. We want to learn select baseline laboratory tests before initiating psychiatric medication. We are going to determine appropriate follow-up lab monitoring schedules. We are going to learn how to interpret abnormal lab results relevant to psychiatric medication, identify medication specific lab monitoring requirements, recognize psychiatric emergency related to lab abnormality, apply monitoring recommendations for a specific population. So generally there is a general baseline evaluation before prescribing most psychiatric medications. You want to obtain comprehensive assessment that include history, medical history, psychiatric history, family history, current medication, allergies, substance use history, pregnancy status when is appropriate. You want to also assess the physical assessment such as height, weight, body mass index, waist circumference, blood pressure, heart rate. Baseline lab study include complete blood count, and the purpose is to detect anemia, infection, thrombocytopenia, neutropenia. You want to also do the complete metabolic panel to assess electrolytes, kidney function, liver function, glucose. You want to also do thyroid assessment and thyroid function. You want to evaluate thyroid disorders that can contribute psychiatric illness and psychiatric symptoms. You want to also assess the blood glucose, hemoglobin A1C. You want to screen diabetic. Before you prescribe antipsychotic medication, you want to also assess the baseline lipid panel. You want to assess, the purpose is assess the cardiovascular risks. You want to assess pregnancy. You want to do the pregnancy test before medication with the fetal risk. do the pregnancy test before prescribing medication with fetal risk. Urine drug screening to evaluate substance use when clinically indicated, when the patient is having symptoms or if they tell you that they are using either alcohol or drugs. You want to also evaluate vitamin B12 to rule out reversible cognitive or mood symptoms. Most people that I saw in the hospital who have vitamin B12 deficiency are the people who are using alcohol. Folic, you want to assess the folic level so you can assess nutritional deficit. Vitamin D to consider a patient with mood disorder or osteoporosis risks. Specific medication monitoring. If you want to prescribe second generation antipsychiatric medication, you want to assess the baseline and you want to monitor that. These medications are associated with metabolic syndrome, weight gain, diabetic, and dyslipidemia. So you want to assess the baseline lab that you want to assess will be the blood pressure, fasting glucose or A1C, weight gain, baseline body mass index, waist circumferences, fasted lipid, follow-up appointments that you want to set up and follow and assess after you prescribe the medication include weight gain, body mass index, blood pressure, hemoglobin A1C or fasting glucose. You want to assess the frequency, weight. You want to assess every visit for the first 6 months, then periodically. If you prescribe second generation antipsychiatric medication, you want to assess the weight every visit for 6 months, and then periodically. Body mass index every visit initially. Blood pressure approximately 3 months after the initial dose, then at least every year. A1C you wanted assess approximately 3 months after the initial dose, then every year, more than if it's high risk. Lipid panel you want to also assess approximately every 3 months after the initial dose, and then yearly or according to the cardiac risk. If the patient have a heart attack, if the patient have a cardiac risk, and you already prescribed you for second generation antipsychiatric medication, you want to assess the lipid panel approximately every 3 months after the initial dose. Then you want to assess yearly or according to the cardiac risk. Waist circumference is the every year. Highest metabolic risk medications, antipsychiatric medications are olanzapine, Cyproxa, and clozapine. Low metabolic risks antipsychiatric medications are epaprazole, Lusandan, and Saprazadine. So the low risk metabolic risk include Abilify, Lutadine, and Geodan. They have a low risk of a metabolic risks. Clozapine monitoring required. Clozapine has the most extensive lab monitoring requirements of for any commonly prescribed psychiatric medication. Clozapine causes absolute absolute neurophilic count, it causes absolute neurophilic count and requires absolute neurophilic counts because of the risk of severe neurotropism and agnosis. Typically, you want to monitor weekly during the first 6 months, and then every 2 weeks for the next 6 months, and then monthly thereafter. Also, you want to monitor the weight gain, body mass index. You want to monitor the A1C, lipid panel, CMP, comprehensive metabolic panel. You want to also monitor the troponin and C-creatine protein. If a cardiac risk is suspected, you want to monitor the electrocardiogram when indicated for clozapine. Lithium monitoring. Lithium has a narrow therapeutic index and requires frequent monitoring. Baseline will be blood urine nitrate, creatine to assist the kidney function, kidney filtration, thyroid hormone, calcium, pregnancy test, cardiac assessment, electrocardiogram for older adults or those with cardiac issue. The therapeutic blood concentration of a lithium typically target ranges if the patient has acute mania. You want the level to be 0.8 to 1.2. If the therapeutic is to maintain the level of therapeutic level, it is 0.6 to 1. Obtain a blood level approximately 12 hours after the last dose. TRAT level. Follow up. You want to follow up with lithium Follow-up tests, you want to follow up lithium level approximately 5 to 7 days after the starting dose or changing the dose. Then every 3 months to 6 months when the level is stable. You want to also assess the kidney function every 6 to 12 months. You want to assess the thyroid every 6 to 12 months. Calcium at least once a year. Signs of lithium toxicity include tremors, ataxia, confusion, vomiting, diarrhea, slur speech, seizure, and coma. Risk factors include dehydration, reduced kidney function, interaction other medications such as thiazidine, diuretics, ACE inhibitor, ARB, angioreceptor blocker, NSAIDs. Those can affect the lithium level. Also, fibrate, you want to monitor fibrate. Baseline lab for fibrate include complete blood count, liver function, pregnancy test, weight gain. Therapeutic level of fibrate for patients with bipolar disorder commonly target ranges to 50 to 125 ml. And follow-up testing for fibrate is you want to assess the fibrate level after the dose adjustment and prior. You want to assess the liver function periodically, complete blood count periodically, weight gain every visit, and you want to assess the side effects. Serious side effects of fibrate include liver toxicity, pancreatic inflammation, thrombocytopenia, hyperammonemia, notoral tube defect if the mother is pregnant, carbamazepine, you want to monitor the complete blood count, complete white blood cell, complete blood count, complete comprehensive metabolic panel, liver function, sodium level, pregnancy test. Certain patient of a certain Asian ancestry may be screened for HLA-P 1502 before initiating because of the increased risk of skin issue. Stevens-Johnson syndrome, toxic epidermal necrosis. So this medication can cause some patients of Asian ancestry. So you want to screen the enzyme that can increase the risk of Stevens-Johnson syndrome. The therapeutic concentration commonly targets 4 to 12 microgram. Follow-up labs include complete blood count, liver function, sodium level, valproate level when indicated. Serious side effects that you want to monitor include granulocytosis, which is white blood count, aplastic anemia, Stevens-Johnson syndrome, low sodium, lamartachine, you want to assess routinely, you want to assess the drug level. You want to monitor particularly skin irritation, rash during the dose adjustment or dose initiation, because the serious side effects include Stevens-Johnson syndrome. Patients should be instructed to seek immediate medical evaluation for new rash, particularly accompanied by fever and mucosal involvement. Medications such as SSRIs are routinely monitored. Routinely lab monitor is not required for most healthy patients. However, you want to consider sodium in the older adult or the patient who is risky for SIADH, SIADH, liver function test, pregnancy test, sodium level test, increased bleeding risks, sexual dysfunction, serotonin syndrome, which is rare but can happen, SNRIs, which is you want to monitor the blood pressure and heart rate. Venlafaxine may increase the blood pressure, especially at the high dose. Tricycline antidepressant medication. The baseline lab monitoring include electrocardiogram in older adults or the patient with a cardiovascular disease. Blood pressure. Drug level may be measured in a selective cases such as suspecting of a toxicity and non-responding to the treatment. You want to also monitor MAOIs. Routine lab monitoring include the blood pressure, weight gain, liver function. Provide through dietary counseling to reduce the risk of hypertension crisis. Stimulant medications, you want to assess the blood pressure, heart rate, weight gain, height for the children and teenagers. Follow-up should include pediatric assessment of this primary and monitor of appetite suppression and growth effect in teenagers and children. You want to assess EKG. Consider obtaining EKG before and during the treatment when the patient are known to have cardiac risk, syncope, dizziness, arrhythmia, prolonged QT interval risks, use of other medication that can increase the QT intervals, endocrine monitoring, you want to monitor the prolactin, you want to monitor some psychiatric, particularly Risperdal and Paliperidol may increase the prolactin level, so you want to assist that. Creatine measured when neuroleptic malignancy syndrome is suspected. Associated with finding is a severe muscle rigidity, high fever. So neuroleptic malignancy symptoms include severe muscle rigidity, high fever, altered mental status, aerodynamic instability, elevated creatine kinase. This is a psychiatric emergency. So neuroleptic malignancy is psychiatric emergency. You want to test the liver function. Liver function test is done particularly medications such as fulbrate, carbamazepine, and some antipsychiatric medications. Abnormal result may indicate medication-induced liver injury and require prompt evaluation. When do you assess kidney function? Kidney function is closely monitored when the patient is taking lithium, older adults, chronic kidney disease patient, dehydration risks. You want to assess the kidney function. Medication like lithium is most important lab to monitor is the lithium level, kidney function, thyroid function, and calcium. So if you prescribe a lithium to a patient, you have to assess the lithium level, kidney function, thyroid function, and calcium level. Clozapine, you want to assess the absolute neutrophilic count and metabolic monitoring because it can cause metabolic abnormality and white blood count. It affects the white blood count. Fulbrate, you want to assess the complete blood count, liver function, and fulbrate level. Carbamazepine, you want to assess the complete blood count, sodium level, liver function, and carbamazepine level. Lamartine, you want to assess the clinical monitoring for Steve-Johnson syndrome. Second generation antipsychiatric medication, you want to assess the lab. You want to monitor the weight. You want to monitor body mass index, blood pressure, glucose, hemoglobin A1C, and lipid panel. SSRIs, usually no routine labs, but considered as sodium level in high-risk patient. SNRIs, you want to assess the blood pressure, and heart rate. Stimulant medications, you want to assist the blood pressure, heart rate, weight gain, and height and growth of the children. Lithium monitor kidney function, thyroid function, calcium, and lithium level. Clozapine requires mandatory absolute neutrophilic count monitoring due to the risk of severity neurotropenia. So it has a risk of severity of a neurotropenia. Second generation antipsychotic medication, you want to think metabolic syndrome. So you want to monitor the weight, glucose, lipid panel, and blood pressure. Fulbrate, you want to monitor liver function test, complete blood count, because of the risk of a high liver toxicity and thrombocytopenia. Carbamazepine, you want to monitor complete blood count, sodium, liver function, and consider HLIP-1502 screening in at the risky population for that enzyme. Lamotrigine, you want to do the routine lab monitoring. It's not necessary, but educate every patient about the early sign of Stevens-Johnson syndrome. I have a question for you. Let us begin. Which lab test is mandatory before dispensing clonazepam and throughout the treatment? I want to give you a minute to think what lab test you have to monitor before giving patient clonazepam. That is absolute neurotrophilic count, or ANC. ANC is the lab to monitor. A patient is taking a lithium and present with confusion, tremor, vomiting, and ataxia. Which lab test should be obtained immediately? Take a time and think about that. That is the lithium level. Which lab tests are most important to monitor a patient with fulbrate? Most important lab for fulbrate. Most important lab for fulbrate is a complete blood count and liver function. So you want to memorize, and simple memorization that you can use will be when you think about lithium, think about the kidney, think about the thyroid, think about the calcium, and you want to assess the levels. When you think about clozapine, think about ANC level, and metabolic monitoring. Fulbright, you want to think about liver, platelet, CPC, and drug level. Carbamazepine, you want to think about complete blood count, sodium level, and liver function. Second generation antipsychiatric medication, thinking about the weight, waist, blood pressure, blood sugar, and lipids. Thank you for joining me today. I will love to see you in my next video. Thank you.